Thank you for coming, and I want to acknowledge the context for this session. The BAME review report is being launched this morning amid a global pandemic. And just to recall that we're also in the middle of Black History Month. In this International Year of the Nurse and the Midwife, which has just shown how consistently nurses and other health and care and voluntary sector people have risen to the challenge of delivering complex care to diverse communities. This pandemic has shown us that racism and structural inequality aren't simply intellectual concepts, quite the opposite. COVID-19 has shown us that racism and inequality is real. It impacts on our bodies as much as our minds. It shortens lives and it is squeezing our breath. The health inequalities faced by Black, Asian and minority ethnic communities also tells us a great deal about what we value as a society. It tells us where organisations place their attention and fundamentally what we're all prepared to tolerate as communities who live with the impact of structured disadvantages and inequalities. In many respects, it'd be all too easy to continue to do what large-scale systems perhaps have always done, to carry on with the day-to-day work and deliver business as usual and conveniently forget these tough and uncomfortable truths. And that's why I'm incredibly proud to have chaired this review, because we collectively have dared to ask and start to answer some of these tough questions. We've sought to deliver collectively, be curious in order to seek out the experiences and voices that have been seldom heard and are too easily ignored. And we've tried to create an active and vibrant partnership that at every layer is committed to changing outcomes for patients, staff, and the communities within this footprint. This review faces the future with a plan and a solid partnership that is determined to be the change that we want to see. It is a testament to everyone who has contributed to it, but most of all, it's delivered in the service of the communities of West Yorkshire and Harrogate who deserve to live their lives by organisations who have a profound understanding of the contribution that they actually make to delivering social justice. For the staff across every sector that contributed, this review speaks to your vision and insight about creating truly inclusive organisations. It shines a light on your generosity and continued commitment to excellence and to sharing your learning that will play a large part in its success. For communities, your intelligence and your breadth of understanding have been remarkable. For the leaders at every level of organisations involved in this review, your willingness to work through complexity, plurality, coupled with the energy for change is absolutely necessary for this process. And I want to thank all of you that we were able to deliver this review. I really am impressed about the connections that have been forged. They've been necessary and we've had important conversations. But more important than that, we have made promises to our people and our community. We know it's going to be hard and we know that things aren't always going to go to plan, even when we've disagreed about things. But I do believe that we're richer and wiser and better equipped than ever before to deliver the change that we so desperately need. And coming together is actually the start. Staying together and achieving what we set out to do must be where we focus our energy from now on. So colleagues, I am absolutely delighted to commend this review to you and to urge others who want to change to get in touch, get involved, adapt their processes to deliver change in your area. This isn't just a singular moment, but a movement for equity. So please join us. Thank you.